Doctors, what obvious thing did you have to explain to a patient that everyone should know? I'm a veterinarian.
One woman brought in her cat, which turned out to be pregnant. She refused to believe it was possible because her cat was strictly indoor. After further questioning, it turned out there was an unneutered male cat living in the same house. But according to the owner, he couldn't possibly be responsible because he was the cat's brother.
Yes, cats live by their own rules.
One woman measured her child's temperature by turning on the stove, holding one hand over it, and placing the other on the child's forehead. She told the nurse her child's temperature was about 120 degrees. I had to explain to a woman that she needed to brush her 4-year-old's teeth. She brought her daughter in for a sore throat. When the child opened her mouth and the tongue depressor was inserted to examine her, as 4-year-olds often do, antibiotics were prescribed. Later, all her teeth had to be removed due to a severe infection. Once, I had a patient diagnosed with cancer. He was very upset, believing he could no longer see his family. This confused me because I had spoken to his wife and relatives, and it was clear they were very supportive.
There were no signs of family issues.
It turned out he had heard the words genetics and family history and thought it meant the disease was contagious, leading him to believe he had to stay away from his loved ones to prevent spreading it.
That was one of the few explanations I gave a patient with pleasure.
One of my professors shared a story from when he worked in gynecology. According to him, a woman was prescribed birth control pills but kept getting pregnant again and again. She complained that she took the pills every evening and didn't know why they weren't working. In the end, the professor found out she wasn't swallowing the pills. She was inserting them into her vagina because she thought that's how they were supposed to be taken. No one ever thought they'd have to explain how to take birth control pills.
I'm an EMT.
During clinical work in the ER, a 17-year-old girl came in with rectal bleeding. I had to explain to her how to wipe properly. No joke, a 29-year-old guy came in after seeing corn in his stool. He genuinely thought something was wrong with him. A staff member at a nursing home called 911 because a patient was having breathing problems. When we arrived, the physician's assistant was standing in front of the patient, vigorously fanning her. She looked at us and said, "I'm trying to get her some oxygen because we couldn't find a portable oxygen tank." Then she continued fanning her with her hands. Mind you, she was a physician's assistant. I told her she could stop, and my partner and I barely made it to the exit before bursting into laughter.
I'm an ER nurse. One patient came in for an STD check.
She was very upset and kept repeating that she only had one partner. As I continued my work, she mentioned that even if he slept with others, it shouldn't matter because he always used a condom and washed it afterward. I asked what she meant, and she explained that he washes his condom after each use. She said that before reusing it, she washes the condom with soap under hot water. I had to explain that condoms are single-use. She had no idea. Once, during my surgical residency, I was sent to the ER for a patient with a suspected inguinal hernia. I arrived and saw a very calm guy. I started asking standard questions and began the exam. When I got to his groin area, I noticed a bulge. Then I checked his scrotum and found he only had one testicle. It's very rare for testicles to retract into the inguinal canal in people with hernias, and it can be dangerous if blood flow is compromised. So, I asked the guy how long he'd had only one testicle. He looked at me like I was crazy and said, "What? I've always been like that." I was confused and tried to rephrase the question, but he still didn't get it. I explained that he should have two testicles, but his scrotum only had one. He started arguing with me, saying everyone has a different number of testicles and he was just one of those with only one. He got defensive, so I decided not to argue and scheduled him for urgent surgery. I went to the prep room to meet my resident and saw he was already talking to the one-testicle guy and his girlfriend. They pointed at me and got into a heated argument with the resident. I approached and asked what was wrong. They started yelling that I was trying to trick them into thinking there was something wrong with his testicles, causing unnecessary worry. The resident and I had to explain to the guy and his girlfriend that the vast majority of men have two testicles, and having only one isn't normal. They refused to believe us. In the end, we took him to the operating room, retrieved his undescended testicle, and, long story short, it looked more like a diamond than a testicle. It was very hard and compact, like a superdense, solid oyster, if anyone's curious.
I work in the ER.
I had to explain to a 27-year-old woman that monthly bleeding for a week is normal and why it's normal. By the way, she had 2 children.
I'm a man.
My mother is a nurse and has been working for over 25 years. The only story of hers that makes me cringe happened with a man who couldn't afford Viagra and decided a cock gun would do the job. Think about it, if you stick it in there, it'll help maintain an erection, he thought. Long story short, he inserted the tip of the cock gun into his urethra.
Don't do this. For God's sake, don't do anything remotely like this. I'm an ophthalmologist.
Literally today, I had to explain to a patient that under no circumstances should they try to insert a contact lens that fell into the toilet.
The hospital is open 24/7 for emergencies.
So, if you have a stroke on Friday, come in on Friday, not wait until Monday. After a man got several stitches on his head, his relatives asked if he was okay. The attending doctor jokingly said they managed to keep his brain inside his skull. The patient's family was shocked by this news. As a medical student, I had to spend half an hour explaining to his family that the brain is located inside the skull and you can't live without it. They thought the brain was just a figure of speech for mental abilities, not an actual organ. They thought the same about the heart. My grandmother was the ignorant one who needed this explained. She was 18, preparing to give birth to her first child in the late 1940s. The nurse looked her up and down and told her to put on a delivery gown. She took off her shirt and bra and lay on the bed. The nurse was surprised and said, "Take off your pants too." "Why?" "The baby comes out of my belly button, doesn't it?" my grandmother asked. "Where it went in, that's where it comes out." Hi, I work in a pharmacy, and we constantly get the wildest questions. One time, we got a call from a clearly upset woman asking if we had larger-sized NuvaRing vaginal contraceptive rings. My first thought was, my God, how wide is your vagina? But then I realized all NuvaRings are the same size. I suggested she come to our pharmacy's information desk to sort out her issue. When she finally showed up, you won't believe it, she was wearing the NuvaRing like a damn bracelet. She genuinely believed that wearing it on her wrist would let her have unprotected sex without consequences. You should have seen her face when we told her it's a vaginal contraceptive. She turned pale, said thank you, and bolted out of the pharmacy. I felt bad for her, but I couldn't hold back my laughter. I work at a veterinary clinic, and sometimes I don't understand pet owners. A client's dog, Bob, wasn't eating well, and he didn't know why. I visited him and asked him to show me the feeding routine. He filled a bowl with dry food, and the dog looked excited to eat. But then, believe it or not, he went to the fridge, grabbed ketchup, and generously poured it over the dry food. My jaw dropped, and the dog, right in front of me, instantly lost interest in the meal. I politely asked Bob what he was doing, and he explained that his whole family eats everything with ketchup. I spent 15 minutes explaining that his dog probably didn't like food with ketchup. After that, the dog started eating with gusto, and they called me a miracle worker. I work in the ER. I had to explain to a 19-year-old girl that she needs to change her tampons much more often than once a month. By the way, she had septic shock. If you're constipated, you don't need to stick a steak knife up your rectum. Sad, but not a joke. I'm a medical student. Earlier this year, I was asking a patient on a ward bed about his symptoms, with other students and our supervising doctor present. I used the word penis, and he looked at me confused. I repeated it, but he still didn't understand. Eventually, I had to ask if his dick hurt when he urinated. He finally got it. By the way, the man was over 40. I had to explain to my 75-year-old grandmother that ears aren't connected by a single canal. When preparing to use ear drops, she lay down and stuffed cotton in the other ear to keep the drops from leaking out. Be sure to subscribe to our channel so you don't miss new, super interesting discussions. Become our patron via the link in the description and listen to our episodes in the background without ads or censorship. In the meantime, check out our other videos.